Hello and welcome to this short introduction to NHS Pharmacy First for surgery reception teams. We will cover what it's all about and how NHS Pharmacy First provides new referral options for reception teams. From a reception team perspective, Pharmacy First could be considered to be an enhanced version of the community pharmacy consultation service. However, it is a significant step up for pharmacists because they now have the possible option of supplying prescription-only medicines as might be required for 7 specific conditions, which has required considerable extra study and accreditation. The core patient benefits remain the same, which is they can expect a same-day consultation with a pharmacist. This slide shows the 7 conditions and the age restrictions that pharmacists have to be aware of before they can offer a prescription treatment. Please note this point because pharmacists are required to refer back patients outside of these age ranges. In particular, note otitis media or earache because for some reason the NHS pharmacy protocol does not allow us to treat adults 18 and over with this condition, and unfortunately they will have to be referred back to the surgery. Remember also pharmacists can offer over-the-counter treatment options where symptoms are less complicated, especially if referred earlier. Most reception teams will already be familiar with this referral guide, originally for CPCS, which lists around 72 green symptoms, all of which are treatable with over-the-counter medicines. With Pharmacy First, pharmacists can now go a stage further with some of these, as highlighted, and offer prescription medicine treatments if any of the 7 conditions are diagnosed. So it may actually be easier for surgery reception teams to just continue using this highlighted referral guide with its easy symptom terminology and just leave it to the pharmacist to think about whether it might be appropriate to treat the issue with a prescription product. Whereas this additional referral guide looks more specifically at the 7 conditions where a prescribable treatment may be the appropriate clinical option. The simple symptoms to use for referrals are in the green boxes. If you use this, please try and avoid mentioning the actual diagnostic terms in the white boxes to patients because it influences their expectations for antibiotics. I'm sure reception teams are well aware of how unhelpful it is when patients arrive demanding a prescription for antibiotics, regardless of what the clinician says. A red flag issue is when something more serious may be going on, and the point here is that when you refer a patient electronically, the responsibility for spotting red flags passes over from the surgery to the pharmacist. And using the PharmRefer system provides a very good way of showing that you have done it. The consultation protocols that pharmacists follow are designed to identify red flag issues because we know that patients don't always mention what they should to receptionists who are trying their best to assist. So please be reassured that it is a good sign of the protocols working when patients are occasionally referred back. Perhaps even said to patients that you were glad the pharmacist spotted whatever it was and that you will try and get an appointment squeezed in a bit sooner now rather than later. Let's just quickly remind ourselves on how to use the referral guide, and let's use insect bites and stings to illustrate. The patient says they've had a wasp sting and their arm has already swollen, which is a green referral symptom. It looks a bit weepy to you and it may be infected, but that is not a red flag, so do carry on with the conversation. Then the patient mentions funny chest palpitations. You will see this is on the red do not refer side, so this patient needs to see a clinician in the surgery. Using the additional referral guide is the same in principle as using the original CPCS referral guide. The example patient here is a 20-year-old female describing a burning sensation when peeing over the last 5 days. She is not pregnant or breastfeeding. She mentions griping pain in her lower abdomen. So these green box symptoms so far are all pointing towards a pharmacy referral. However, she then says she is experiencing some back pain and is holding her side. You can see this as a red box symptom, which means the patient needs to see a surgery clinician, in this case because of a possible kidney complication. It is helpful to understand the patient journey along the pharmacy first pathway, starting with the patient phoning or turning up at the reception desk. The primary objective for reception teams is to stream the patient to the most suitable clinician, whilst appreciating this is in the context of scarce GP appointments. And receptionists will be especially aware of the availability of surgery appointments on a day-to-day basis. So consider a patient presenting and describing symptoms that could be seen by a pharmacist. Receptionists might quite positively and helpfully suggest you can arrange a same-day NHS consultation with the local pharmacist, since there may be a wait of several days to see a doctor or other clinician at the surgery. If the patient is happy to be referred to the pharmacy, simply send the electronic referral message to the pharmacy and advise the patient that the pharmacy will phone them within 4 hours to arrange an approximate time for a consultation. After the consultation, the pharmacist will send an electronic outcomes report back to the surgery for input into the patient's medical record, including details of any medicines supplied. Sometimes the outcome is advice only, or possibly advice plus an over-the-counter medicine. Reception teams are aware the NHS advises doctors not to prescribe OTC medicines like ibuprofen or paracetamol, and the same guidance applies in this NHS Pharmacy First service. So patients would be asked to pay for such medicines. Whereas, if a prescription medicine is needed, then the normal NHS payment or exemption rules apply. Sometimes the pharmacist may refer to another clinician, such as an optician, or if there is a red flag symptom, the pharmacist might escalate back to the doctor or possibly to A&E if it was deemed necessary. That was the principles of Pharmacy First, whereas this slide illustrates some of the outcomes that could arise for a given symptom, in this case headache. Here the possible issues arising identified by the pharmacist include lifestyle problems, migraine, eye strain, perhaps menstrual cycle related, concussion, and even mini stroke, all potentially arising from a referral for headache. So it is usually best to simply give the main symptom arising in the referral and leave these broader considerations to the pharmacist. This slide highlights the importance of a conversation between the reception manager and the local pharmacist manager to reflect on the surgery's preferred processes for such referrals back. It would be good to confidentially share your side door telephone number so that pharmacists can get through on the phone if an urgent issue arises. Having spoken about referral backs, I would share this wonderful data set of CPCS outcomes, which shows, for example, 80% of referrals for cough, cold and sore throat symptoms were resolved by the pharmacist. 75% of skin rash problems were sorted, 81% of diarrhea and constipation problems, 80% of minor eye problems. So please assure patients that a pharmacy first consultation for these conditions is most likely to resolve the problem. All pharmacy first referrals should be made electronically, whether for any of the 72 minor ailment symptoms or for any of the 7 that the pharmacist can now prescribe for. So it is simpler for reception management to adopt one consistent referral process. We recommend all System 1 practices use the PharmRefer app. It is so very quick, the referral can be completed whilst the patient is still on the phone. Just tick the symptom, select the nominated pharmacy and send. Please note that the PRISM form for pharmacy referrals is being retired shortly. This screen illustrates the PharmRefer logo, which hopefully all System 1 reception teams will be familiar with. If not, just Google PharmRefer training video for a 4-minute illustration on how it works. And if you need some setup support, please just email melanie.burdett@nhs.net, who is at LLR-ICB. This slide shares the key reasons for why the surgery team should send electronic referrals. A key one is referred patients will be seen by a pharmacist in their private consultation room, whereas walk-in patients are likely to be seen by a chemist counter assistant. Another important reason is an electronic referral confirms the transfer of care from the surgery to the pharmacy. This is important because the patient came expecting to see an NHS doctor in the first instance, so creating a duty of care for the surgery. An electronic referral will therefore helpfully record that care has been transferred over to the pharmacy. Consider also DNAs or did not attends, which can be problematic if the patient says yes to a verbal suggestion to go to a pharmacy and then they choose not to. What if the patient does not take the advice and went straight home and perhaps sepsis set in, whereas the pharmacy would have contacted any referred patients to arrange a consultation, which helpfully serves to chase them up and so reduce the risk. Electronic referrals also helps collect audit evidence and data. Electronic referrals illustrate compliance and can show that patients are accessing care within the recovery plan's target of 24 or 48 hours, whereas verbally referred patients cannot be counted towards the performance of the practice. Another quite important point is that pharmacists like the professional courtesy of receiving a referral because they can anticipate or phone the patient rather than them just turning up, because otherwise Sod's Law dictates they will arrive during a frantically busy time or when staff are at lunch, and so the patient may have to wait longer than they might expect to, so the consultation gets off to an unsatisfactory start for all involved. Perhaps the most important of these reasons are that it is better for patients and it confirms the transfer of care from the surgery team to the pharmacy. Some poster resources are also available to support implementation of pharmacy referrals from your surgery. These have been designed to inform patients that the NHS Pharmacy First service is a high-quality, planned and considered NHS treatment pathway. So it is important that it is presented as such from the referral process through to service delivery in the pharmacy. Unfortunately, some patients have reported feeling rather fobbed off to the pharmacy, where referrals have not been handled sensitively, whereas we feel that this refreshed and enhanced NHS Pharmacy First service can provide an excellent level of care to our patients. I trust that this was helpful. Please don't hesitate to email service support for further information, or visit our website if you wish to review this presentation again and for downloadable copies of the referral guides. Good luck with your Pharmacy First services. Thank you.